Thank you for purchasing the revolutionary Core Laser Pro. It is very important to read the instructions in their entirety. There are numerous gains to be had from using the Core Laser Pro, but failure to follow the directions and improper use of the product may not produce the desired results and may even cause injury. While the Core Laser Pro has benefited many people with back pain, dependent on the medical condition you are treating, it may or may not benefit every patient. As with any treatment or exercise plan, we recommend that you never require patients to exercise beyond the level at which they feel comfortable. If at any time patients are exercising beyond their current fitness ability or feel discomfort, you should discontinue the exercises immediately. Let's begin. Start by setting up the target. Now, adjust the height of the target so that the center line, the x-axis, is roughly at the patient's pelvic height. Next, place the core laser belt around the patient's waist and adjust the belt so that the device is pressed firmly to the pelvis, about 3 inches below the navel. Pressing the button on the front of the laser, turn it on, and facing the target, align the patient so that the beam of the laser begins in the origin of the X and Y axis. Fine adjustments can be made by tilting the laser in the housing. Instruct the patient to keep a slight bend in the knees and maintain an upright posture. It is important to maintain this position while using the product. Now that we are properly preset to do the exercises, let's remember 4 very important rules of the Core Laser Pro. 1. Do not strain or overexert. 2. Do not sacrifice posture. 3. Do not rush. And 4. Maintain perpendicular shoulders to the target at all times. Exercise 1. Posterior and anterior pelvic tilts. Instruct the patient to do the following. Stand up straight with feet parallel and knees slightly bent. Slowly contract the lower abdominals, pulling the navel towards the spine and making a posterior pelvic tilt. The laser will trace a straight, vertical line upward on the y-axis of the target. Try to point the laser as far upward as possible. It is important not to lean back or otherwise move the upper body. The head, shoulders, and ribcage must remain still. Now reverse the movement and bring your pelvis back through the origin of the target and continue to make an anterior pelvic tilt, contracting the lower back and causing the laser to trace a line downward on the y-axis. Once again, it is important to not lean forward or otherwise move the upper body. Start with 10 repetitions in each direction, slow and steady. Exercise 2. Pelvic twists. Instruct the patient to do the following. Stand up straight with feet parallel and knees slightly bent. While maintaining pre-movement positioning and keeping the ribcage, shoulders, and head completely still, slowly twist the hips to the left so that the laser traces a smooth horizontal line across the x-axis. The knees must remain forward pointing and feet remain flat. The laser should trace a straight line and should not move up or down on the x-axis. Then twist the hips the opposite direction in the same manner. Your shoulders will want to move with your hips. Don't let them. You must be self-aware and focus on isolating the movement of the hips. Start with 10 repetitions in each direction. Remember, breathe deeply and slowly. Exercise 3. Circular dynamic pelvic tilts and twists, blue circle. Instruct the patient to do the following. Stand up straight with feet parallel and knees slightly bent. Move the hips into an anterior pelvic tilt position by contracting the lower back. The laser should point at a downward angle at the bottom of the blue circle. Now, keeping the head, shoulders, and ribcage still, contract the left side and then use the abdominals to cause a posterior pelvic tilt as the laser traces half a circle in a clockwise direction from the 6 o'clock position to the 12 o'clock position. Continue tracing a clockwise circle, returning to the 6 o'clock position. The laser should trace a smooth, even circle. If you cannot make a full circle or your hips are catching in a particular spot, simply step further away from the target instead of overstraining to achieve the movement. We are always trying to increase range of motion while using a reasonable level of exertion. Now, repeat the movement in the opposite direction. It is important to move the pelvis while keeping the legs and shoulders still. Start with 10 repetitions in each direction. Exercise 4. Horizontal figure 8 pelvic tilts and twists. Green pattern. Instruct the patient to do the following. Stand up straight with feet parallel and knees slightly bent. To start, aim the laser at the origin of the axis. Move the laser beam following the right portion of the figure 8 until it is back to center, and continue tracing along the left portion of the figure 8 to complete the pattern. Repeat in the opposite direction. Once again, tracing closely around the figure 8 shape is important, but not at the cost of sacrificing rhythm and fluidity of the movement. It is important to keep the head, shoulders, and legs as still as possible. Start with 10 repetitions in each direction. Exercise 5. Horizontal figure 8 pelvic tilts and twists, yellow pattern. Instruct the patient to do the following. Stand up straight with feet parallel and knees slightly bent. To start, aim the point of the laser at the origin of the axis. Trace the beam along the right portion of the figure 8 back to center, then tracing along the left portion of the figure 8 to complete the pattern. Repeat in the opposite direction. Once again, tracing closely around the figure 8 shape is important, but not at the cost of sacrificing rhythm and fluidity of the movement. It is important to keep the head, shoulders, and legs as still as possible. Start with 10 repetitions in each direction. Remember, this movement will be more difficult than the previous figure 8, so, if need be, do not hesitate to have the patient take a step back away from the target. Exercise 6. Vertical figure 8 pelvic tilts and twists, red pattern. Instruct the patient to do the following. Stand up straight with feet parallel and knees slightly bent. Aim the point of the laser at the origin of the axis. Move the pelvis upward and to the left, tracing the point of the laser around the top portion of the figure 8. Then back to center and around the bottom portion of the figure 8 until you have completed the pattern. Now repeat in the opposite direction. It is important to keep the shoulders and legs still during this exercise. It is also important to trace the pattern as closely as possible, but even more important to try and make the movement as fluid as possible.